As more people get their COVID vaccines, there are several do's and don'ts to keep in mind.
Fox 17's Ryan Cummings joining us live from the newsroom with what you need to know about alcohol as well as pain relievers. Ryan.
Guys, when it comes to alcohol, there is really no guidance from the CDC or the FDA on whether it is safe to drink right before or after getting your COVID shot. But one doctor tells me there are recommendations that everyone should follow.
First of all, it's good to get that day scheduled as soon as possible.
Dr. Matt Biersack is the interim president and chief medical officer at Mercy Health St. Mary's, one of the partners at the West Michigan Vaccine Clinic.
And we're just encouraging people to hang tight, hang with us another few months. I think we can really make sure that we get to all the eligible adults within our community in these next couple months, but we've got to hang in there and stay vigilant.
He tells me there are several things people should pay attention to the day of their shot, whether it's the first or second dose, and the types of medications they're currently taking. There really is not any hard data surrounding whether it's okay to drink alcohol before or after the vaccination. But for alcoholics or others who drink for long periods of time, they tend to have weaker immune systems.
You know, everything in moderation. So it's reasonable to maybe have a celebratory cocktail, but you know, beyond that, it's really probably in everyone's best interest to wait even 48, 72 hours after the vaccination.
There's also a recommendation not to take pain relievers right before the shot. Some may consider that a precursor trying to stop potential side effects, but that may not be your best bet.
Ibuprofen in particular is what we call a non-steroidal anti-inflammatory drug. You know, could potentially blunt the immune response to the vaccine. And so that's the theory behind not taking those types of medications before the vaccination.
After the vaccine, if you're getting those common side effects like muscle aches, pain at the site, or general fatigue, those over-the-counter pain relievers are usually okay.
It's prudent to talk to one's doctor about, you know, what's safe and what's not based on other medical issues people might have or other medications that they might be taking.
Family Fare sends out these documents giving people a rundown of each shot and what to expect. Whether it's Johnson & Johnson, Pfizer, or Moderna, most locations should give you something to read over before getting vaccinated.
For the most part, the vaccine doesn't interfere in any way with medicines used for common conditions like high blood pressure, diabetes, or other, chronic diseases.
If you're on immune suppressing medications like steroids, talk to your doctor first. The CDC has entire pages of frequently asked questions, including what you should wear to your appointment. The answer is loose-fitting clothes to expose your shoulder. Also, drink water because some people feel lightheaded, especially if they're shy around needles. Get plenty of rest and don't plan too many activities over the next couple of days in case you have a reaction.
We're all kind of sick of COVID. It's been, well over a year. Everybody's tired, but we've just got to hang in there a little bit longer because we can get through this if we can continue to follow those guidelines.
He said it best, we are all sick of COVID. Now, in terms of those side effects from the shot, an immediate reaction is one that happens within 4 hours of getting it. So if that happens to you, the CDC says that you should not get the second dose. Live in the newsroom, Ryan Cummings, Fox 17 News.